This is a scary thought, but what about children who are overweight?
Yeah.
Or teens who are at risk for type 2 diabetes? Are they more prone to developing diabetes at an older age?
Sure. Again, that's the tipping point. You know, again, as I said, it's a genetic disease, so there has to be some predisposition along the way. And a child or a teen, and unfortunately we see a lot of type 2s in the younger individuals, and being overweight and sedentary, those two things combined, is the tipping point. That instead of a person waiting till age 60 to get diabetes, that kid at 14 who's overweight and just plays video games could be the age that the diabetes may actually occur.
And I want to get into those risk factors for type 2 diabetes. It's important to go over them. And one of them, unfortunately, some of you can't change, age and family history. But can you talk to me a little bit about those that we see on screen?
Yeah, well, being overweight, you know, a lot of studies have been done that parents, because we were just chatting about kids, parents oftentimes do not view their children as overweight. And a lot of
And you have to sadly break that news to them?
Well, somebody does.
Right.
And unfortunately, it isn't always done. So they're led to believe, oh, yeah, you know, they're just, or you know, we used to think a nice, chubby little kid with rosy cheeks was very, very healthy.
Right.
And the truth is, you know, they're not necessarily so healthy.
And culturally, the more you feed your child doesn't necessarily equate to being healthy.
Exactly. Okay. And in the adult population, too, if you ask people, if you're just looking at someone and you think, yes, that person's overweight, and then you actually ask them, would you describe yourself as overweight, ideal weight, or underweight? And they'll actually, these are studies that have shown that they'll actually say, well, I'm a little underweight, or maybe normal weight.
Right.
Because they're not viewing themselves. I'm not talking about anorexia, where you view yourself very, very big and you're small. But so our perception of what we are or what our family members are not necessarily on target either. So it behooves a caregiver to actually say that to a person, you know, not pussyfoot around. You know, obese is like very demeaning.